Is Nipah virus the next pandemic? Already there are lockdowns in India, but before you think, okay, well, that's in Asia, I don't have to worry just yet. Well, take a look at this. The NIH, that's Fauci's agency, has been testing an mRNA vaccine for Nipah virus since last year. And do you notice here, take a look at this screen, where this mRNA Nipah virus vaccine is being tested?
Bethesda, Maryland, if you're driving and listening to us on the audio version of it.
Well, that's not in Asia. We've been told that there have been breakouts in Malaysia, in India, in other places in Asia. Why, then, would there be vaccine research in Maryland? So don't feel too safe about this. This bad virus, again, has only been observed in Asia, but it's being worked on in a lab in Maryland. So where did they get the material to sample to make a vaccine? Aren't you curious about that? I'm kind of curious about that. We're going to go over that in a minute, what we know about this vaccine. But first to the outbreak. We're being told now people are in masks. We're watching businesses shut down, lockdowns, mass testing, and contact tracing, all the things. So watch the media report about this and how serious they are taking it.
Authorities in southern India are rushing to manage an outbreak of the deadly Nipah virus. 2 people have died. Hundreds are being tested as potential contacts. Salima Shivji is in Mumbai with the details.
Officials are on alert and taking precautions in the southern Indian state of Kerala because of this Nipah virus outbreak, particularly in the Kozhikode district. Some schools are closed, banks as well as government offices. Shops are shuttered and the streets are a bit empty. People are a little nervous, and not just because of the loss to business, says this shopkeeper. After COVID, now we have this new virus and everything is shut again, he says. The Nipah virus spread through contact with fluids of infected bats, pigs, or people is rare but has had. Previous outbreaks do paint a scary picture. During the first one 5 years ago, 21 out of 23 infected people died because of the Nipah virus. Now, authorities say that in this case, they are taking every precaution possible. Kerala's health minister says all of the close contacts of those infected are being tracked and they are in isolation. At least 700 people have been confirmed and identified as people who have had some sort of contact with either the victims or those who are infected, and they are being tested for this virus. Police are monitoring vehicles at checkpoints, and the state has set up containment zones in the district where the infections are clustered. The federal government is also rushing in help, sending in experts to help with monitoring the spread of the virus as well as with contact tracing, while infectious disease specialists are working to study the strain of this virus known to be so deadly, with the state on high alert. Salima Shivji, CBC News, Mumbai.
Okay, so let's get to this death rate in just a minute. I just want to go over briefly that Nipah is a zoonotic virus, meaning it comes from animals. It was first discovered in the late 90s from pigs. Symptoms include fever, headache, signs of respiratory illness that can lead to brain swelling, seizures, or coma. Now, what she said here is that it has a death rate of 40 to 75%. That is a big range, 40 to 75%. And she credits health agencies with those numbers. I was not able to find out which health agencies have actually calculated that number. I saw this number cited on the CDC, the WHO, and the NIH. They all use that number without attribution or citation of a study. So I'm not sure how they come up with that. But of course, that sounds like a really terrifying number, especially given that now the death rate for COVID is so low that we're like, well, we went through COVID and we're here. So I can't verify that, but they're going to yell it at you 40 to 70%, 40 to 75%. Now, again, let's look at this mRNA vaccine that the National Institute of Health began last year. They started this in 2022 before Dr. Fauci retired. So this is a Fauci-approved study. We're going to assume he was paying attention to greenlighting vaccine trials, right? And not too busy going on national media. The trial began last year, and according to clinicaltrials.gov, was completed. The last update was just last week, September 13th. The test was done on 40 people, so they're trialing this vaccine on 40 people. That's not a big sample. And they were only testing different doses, all in 2-dose vaccines. So one shot, a few weeks later, another shot, right? I guess that's the way we're doing it now, this 2-shot vaccine, because they just went straight to, we're going to give them 2 shots of this amount, and then another group, 2 shots of this amount, then another group of 2 shots of this amount. No results have been posted yet. But when we hear about this vaccine, let's keep in mind that this is what they told us, the NIH. Take a look. They are not testing to see if it prevents transmission of Nipah virus, nor are they testing to see if it prevents severe infection of Nipah virus, hospitalization, or death. See here, they are only evaluating the safety and tolerability, and also secondary. Look, that's their secondary goal. The primary outcome is just to see, do people get hurt from this vaccine? The secondary outcome is, do they then develop an antibody response? Now, we don't know if antibody response means that they will do better if and when exposed to Nipah. We do know from this trial, they are not testing transmission.
Joshua Raymond, $10 super chat says, so where's the Indian reporter's mask? It's great dinner theater.
Yeah, I don't know.
And how do we know that this virus exists? I saw someone in the chat saying, sad that they believe that this virus exists. It's a great point. Like, who's doing the verification of this? Who's doing the verification?
Okay, but we're making decisions, like we collectively, let's pretend we're all in a dinner group and we have to say, this is what we know about it. Let's assume that it's real and then look at the data in front of us. So let's pretend, right, that, I mean, I don't know. I have not observed it. I'm going to knock on wood. But what I do know is that the NIH, which was involved in the development of the COVID vaccine, and hid a lot of information in the development of that vaccine and allowed the media to tell us that that vaccine prevented transmission, is now testing another vaccine, and they are not testing transmission. So I do not want to hear that this may prevent the transmission of Nipah virus or protect you from it when they're only testing whether or not people don't get hurt by the vaccine and if they get antibodies. And we don't know that antibodies will actually lessen the severity of Nipah virus. So we need to keep that in mind. Okay. Now, one more thing about the Nipah virus clinical trial is that it has only been observed in Asia, the actual virus in the wild. Why would it be tested in the U.S.? This release here says that they used a prototype pathogen. That means they have representatives from viral families with pandemic potential. Where did they get that?
Fort Detrick, maybe?
Did they make it? Is it safe? Is it a spinoff
It's like,
of Nipah virus? Wouldn't you want to know this? I mean, NIH is taxpayer funded. So these are really important questions like, hey, where'd that come from?
Hey, where'd that COVID
is it
come
safe
from?
in there?
Where'd that COVID come? It was just something. It was from the Spanish flu from early 1900s, and you guys decided to take that out of cold storage and to start playing with it again. Where did this come from? Is this some sort of a leak? You guys are playing with this at Fort Detrick like the other stuff, bringing it out. Why is it in Bethesda, Maryland? It's a great question.
Yeah. How did it get there? Yeah. Right. And
shouldn't we call these people before Congress and ask them, how the hell is this here?
Yeah.
It's apparently killing people in India. And why is it in the United States? How did it get here?
It's just a very strange word, right? Prototype pathogens. Philip, what does that say to you? Does that say that they came up with a near approximation or that they took it from an original sample?
By the way, if you're new to the show, Philip has a degree in molecular biology, right? So that's
no. I don't have a degree. I studied molecular biology.
Studied molecular biology. Okay.
Yeah.
Okay. He's not a scientist, but he plays one in television. So yeah, what do you think? A prototype of this? Like, what does that mean then?
It is not a term that I'm familiar with, a prototype pathogen. So it could be.
They admit
basically the way I'm reading it is that they created something that works like the pathogen they're working on. But I don't know. I would have to look up that specific term. I'm not familiar with that term or what that would mean.
Okay, so there's two possibilities. They had a sample that they took from India that's uncomfortable, or that they created a synthetic.
More likely scenario is B.
Or
Yeah.
that they created a synthetic of it.
Yeah.
Either way, are you comfortable with it on U.S. shores, right? This is something that the public should know about. Now, why is this being greenlit without us knowing about this thing? This release says that the NIH did this as part of its pandemic preparedness plan developed in early 2022 in response to COVID. This is the first clinical trial using prototype pathogen approach since the plan was put in place. So we are to deduce from this, there will be more. They are going to come up with more synthetic viruses and then try and make a vaccine about it. We should know this, right? Maybe we want it, maybe we don't. But we should be eyes wide open here. And they will be messing around with more prototype pathogens for possible pandemics in the future. So we again, that's great. Are there no other biolabs in and around Asia that might want to work on Nipah virus?
What about the 46 biolabs in Ukraine that Hunter Biden was involved with?
Okay,
and
setting
US
those
government?
aside, right? And I know we don't have a high trust factor of biolabs in Asia at this moment, but you might think that there's some there capable of coming up with a treatment to Nipah virus. Does it have to be transported across the world? Is that safe? These are questions we absolutely should be asking. One
question we asked is, what is a prototype pathogen? Just representatives from the viral families within a pandemic potential, according to the National Institutes of Health, the characterization of which is used to develop the medical countermeasure solutions, vaccines, monoclonal antibodies. So they are representatives from the viral family. And
see, that's not clear though, right? We still could have those two possibilities. Either it's synthetically created to represent what they know of the structure of this virus, or it's a piece of it that's been manipulated. We just don't know. So they
don't do gain of function research. They don't do any of that stuff.
Of course not.
That's all conspiracy theory.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.